Hey, I'm Dr. Bob Payne, a veterinarian at southkendall.com. Let's talk about how to treat urinary tract infections in cats. One, most infections in cats aren't bacterial. They're actually inflammatory. And by that I mean they're like an interstitial cystitis. It's just an inflamed wall of the bladder. So how we do it here in our practice is we try to get what we call a cystocentesis and take urine directly out of the bladder with a needle. I know it sounds bad, but we do it in pediatrics and human medicine all the time. We look under the microscope, we see if there's any bacteria in there. If so, then we treat with the bacteria that we think they're in there. Sometimes we culture the urine, but I would say less than 5% of all cystitises or bacterial or inflammations of the bladder are caused by bacteria. Viruses we don't think cause it, but we treat with antibiotics. Sometimes we use anti-stress medications because a lot of these cats are induced by stress. There's a cat outside the door that's screaming, mating, and your cat's upset because it's in its territory, so it's stress-induced. Sometimes you get cystitis is secondary to renal problems, kidney problems, or diabetes. So therefore, sometimes we test for renal function and glucose to make sure you don't have a diabetic situation or a renal failure that's causing your cat to get secondary infections that are secondary to the actual dysfunction above it. So oftentimes the cystitis are secondary or tertiary to the primary cause, which are more important to define than the bacterial or inflammatory cystitis your cat manifests. Again, we sometimes culture. It takes a week. We put them on antibiotics. I put them on 3-omega fatty acids because I like the holistic approach, and sometimes that helps the inflammation. I put them on anti-stress medications as well. So talk to your veterinarian to find it.